A key part of our job at RPNAO is giving voice to the concerns of our members and advocating for strategies that help address those concerns so that RPNs can continue to give the best care to patients across the province. Recently, we've been hearing from RPNs about the changing nature of their work environment, and those changes include some promising new opportunities, but some significant challenges. We wanted to learn more, so we asked you to share your stories, and I want to thank so many of you that answered that call. We heard from new grads, from experienced RPNs working across all sectors, including long-term care, home care, and acute care, and we appreciate that you took the time to share your experiences and thoughts with us. So what are RPNs experiencing at the front lines of care? They've told us they're feeling overwhelmed. Increasing pressures at work are causing stress and anxiety and impacting the mental and physical well-being of those working so hard for their patients. Some nurses told us about the many long shifts where they don't even have time for a washroom break. They're feeling underappreciated. RPNs shared stories of feeling undervalued by their colleagues and managers, or of being subjected to verbal and physical abuse from their patients and sometimes even their colleagues. In fact, the risk of physical assault on nurses is increasing, and so is the fear that nurses take along with them to work every day. RPNs have told us that they're reluctant to speak out because they're worried about losing their job or because there's no clear avenue where they can voice their concerns, and they're uncertain about their future. For the first time in my career, and I've been a nurse for 40 years, I'm hearing about nurses who are leaving the profession altogether, something that we weren't seeing in Ontario 20 years ago. At the same time, we did hear from RPNs who had more positive experiences to share. They described feeling the pride of seeing RPNs in more innovative roles and new environments than they'd ever been before. They shared the stories of how positive it can be when you've got supportive teams and leadership. And they talked about how rewarding the profession can be when they care for patients and have the gratitude from patients and their families. But unfortunately, as many of you will know, the challenges have become more common than not. So what can employers do to support the well-being of RPNs? We've got some ideas. Put the patient first. Ensure that you're creating staffing mixes and models of care that appropriately pair the right professional to the patient needs in order to deliver the best quality of patient care. Plan ahead. As a best practice, employers should be developing flexible staffing plans that ensure that every sick call is covered, and that nurses have access to additional staff at times of surge. For example, by leveraging float nurses and other innovative types of staffing, and ensure that staffing ratios are appropriate to meet the patient needs of that particular unit. We need everyone to stop the blame game. We know there are tremendous demands on our health system, and health professionals as well as management are feeling the toll, but blaming nurses for that situation doesn't foster a positive work environment. When nurses tell you they are too busy to take breaks, and you tell them to just take them, effectively you are forcing them to make a difficult choice between caring for their patients and caring for themselves. And if they make the choice to keep their patients safe, instead of taking a break, that missed break is their fault. Instead, managers need to recognize that they are accountable for providing the appropriate staffing and ensure staff have the resources and support they need to do their jobs, not blame nurses for the failings of a broader health system. And employers can make sure that they encourage RPNs to engage in self-care. RPNAO has developed a number of self-care resources and tools that are available on our website, and we encourage you to visit rpnao.org and share these resources with your staff, your colleagues, and your employers. We also are hosting a free full-day workshop on self-care. Join us on March 26th for Address the Stress, a full-day event focused on stress management and well-being for RPNs. Visit our website at rpnao.org for more information and to register for this event. And finally, take care of each other. With the daily pressures that nurses face, it can be easy to forget that we're a team and that we're all in this together. After a difficult shift, don't forget that regardless of the sick calls and in spite of the out-of-control workloads, you weren't alone. Look out for each other, help each other, and thank every single person on your team. Once again, thank you so much to all of our members for their stories that they shared with us, and please just know that at RPNAO we remain committed to standing up for you so that you can continue to do the essential work that you do every day to support Ontario patients and their families.